So I'm Melissa Schenkman, and I'm the founder of YMyHealth and co-host of the new YMyHealth podcast.
And I'm Julie Woon. I work as the content strategist for YMyHealth, and I'm also a co-host of the YMyHealth podcast.
And Julie and I have known each other now for a decade, a little more than a decade, which is hard to believe because a decade ago we would have never imagined YMyHealth would be where it is today, and YMyHealth didn't exist a decade ago. I think it is really an important thing knowing where we are now. For me, my background was in like journalism in undergrad and in public health. I had been on the research side. I had been involved in some clinical work in hospitals, and I kind of decided to go back to school after talking to a lot of people in the journalism field, telling me like things had changed because I wasn't in it directly for several years, and social media was starting, Twitter was starting, and so I went back and but still wanted to do health, knew I wanted to do health journalism, specifically reporting. And that is how you and I met, which is amazing. And going back to school and all this, which has led to all this, one of the best decisions I've ever made. But we were both on the broadcast track
Yeah,
at Northwestern. Yeah. Yeah.
yeah,
And and
yeah. It's just funny
yeah.
to think that it's been that long at this point, um, and yeah, that our paths have kind of come together, gone apart, and come back together again. I know I
Yeah.
went to journalism school and afterwards ended up switching over into marketing, and so I had somewhat fallen off of the journalism train for a while. Um, And it was just funny that, around 2020 or so, you had posted about Why My Health Again,
Yeah.
saying, I could really use some SEO help. And I saw the post and I was like, well, that's something I could do that's, marketing related. I very much am in this all the time. And so reached out and reconnected. And now it's just been, uh, you know, bigger and better. And we've grown a lot since then.
Absolutely, absolutely, and it's true, yeah, because in the early days, which is it's hard to believe. Originally, we thought, it was gonna be all video based when we were in school because we were on the broadcast track, and I'd been interviewing a lot of people who at the time were in their 20s who had different chronic conditions, and the one common thing that I would hear and that you would hear is like, "There's no place for us," right? There is no content, there's no particular website that we can turn to for information that on health that's credible, that's relevant to my age. And that's
Yeah.
when this whole idea, yeah, started happening, of let's create a place for our own generation to help them. I had, my background in public health and in research. You are, as we all see, a marketing genius because your undergrad too was in, you had marketing, it's your
Yeah.
background. Now a wealth of experience all these years later with different companies. And so um in the beginning it was going to be all video, and we even went out famously in June when living in Chicago. If anyone listening has ever been to Chicago during the winter or any part of it, which is 6 months of the year, it felt like it is very, very cold. And so this was a 90-degree Chicago day in June when we filmed the original promo on video, which was not the norm. And I think um, you know, shows how strong our friendship was back then, and also how passionate we were about this for us to actually want to be out there in 90
Yeah.
degrees. But back then, to the point, we had several different videos. We were kind of doing an intro video, and then what happened was, for me, both of us, we went back out into the workforce after, being, for me going back, and for you going, for the first time, after grad school. And we, you know, like you said, we kind of parted ways a little bit on, for Why My Health. But at the same time, I kept saying, you know what, video may not be the way to go. I think we want to build an audience. I think we should start a blog. And this is when blogs weren't maybe as popular at that time. And so initially, like, it became Why My Health went from some videos and some video episodes to becoming a blog. And then, like you said, I did a bunch of that in those couple of years. And then in 2020, people had started saying to me, "You got to get this SEO optimization." And so that is when, yes, we reconnected, and you assessed. I think that was the second version of the website that I built, which, having come from a research and public health background, clearly I had never been taught how to build a website. So that was an interesting experience to build that one. And the one we have today that you build is absolutely beautiful. But yeah, so we, started looking at things um, differently then in 2020. And there was such a need in 2020. There was like this whole wake up call, I feel like, of our generation. People, there are plenty of people in Generation Y who are interested in health, but even more once COVID hit in 2020, there was such a demand. And
Yeah,
so I think for that, I'm not sure I was going to say, and we'll cut this part. For some reason, it keeps getting blurry. Do you see that on your end?
it looks okay on my side.
Okay. Okay. That's long as it looks okay. But, but yeah, in 2020, things, just the interest in health information and finding credible health information, I think really soared in our, generation. And so we started building, there was all, building on what had already started with this blog, but we went all the way from 0 articles to now like 170 original stories, is where we're at now, which is pretty incredible. And the other idea from the beginning is, there's health information out there, there are definitions of things, you can find them anywhere. But again, we wanted something tailored to us that would be relevant to us. And part of that, and to get the message across, was I want to hear it from somebody my age, in my generation, because as much as we have love our amazing mentors who are older than us, um I really felt, and I know you felt, that we if we saw someone who was dealing with the same life challenges that we are, because we all share certain generational challenges, moving up in different industries, economically balancing. There's a lot more people now who provide caregiving to older relatives, plus people, have young children that they're trying to raise, or in different points in their relationships. And so I think it's very hard with all that we have going on, because the majority of people we know, including us, um, typically have 2 jobs. And I'm not even talking about if you have children, the raising of children job. I'm just talking about professionally. 2 jobs, a lot of people do. That's a common thing. And so I think trying to figure out how to prioritize your health in the midst of those like 10 other things that are on your plate is really hard. And so if somebody else knows that, it's a lot easier to take their advice and get their message across to you about health, and for you to say like, okay, if they can do it, I can do it. To
Yeah.
prioritize. And so yeah, so we that's how we kind of started looking for people around the country and building our network of Why My Health contributors.
Yeah. I mean, I think it's been something that as we've gone along, like you really see how truly big the gap is in this space. And,
Yeah.
we have our own personal experiences of friends and family who we see it happening in a personal way, but you're not seeing also talked about anywhere else. And it just feels like there are these issues that are um, in some cases seemingly systemic within our healthcare system that are just not being addressed. Or if they are, it's on such a small platform. And I think for us to be able to bring some of those to light, bring awareness to those issues, and get people who are directly affected by it or who have that experience and giving them a platform to
Yeah.
talk is really what Why My Health is all about. And like you said, we've been doing that in a written format for quite a while
Yes.
now. But the discussion came up, this past year of is is this the key format or the only format that we do this in? And so while obviously we love the website, we hope people continue to utilize it as a resource. I think the podcast is what we felt really was going to give a literal voice to some of these people. And so I think we're just both really excited to take Why My Health on this next step of its journey. to
Yeah.
talk to people and let you all hear what they have to say. And so I think for the context of this podcast, what you'll see is Melissa and I taking turns speaking to all kinds of people, physicians, patients, cancer survivors, advocates, caregivers, all sorts of individuals, on a variety of topics, which I think will be exciting. And I think too, we're also very much open to hearing what you guys want to know about, what you feel like is important to discuss. And so that's another piece I think of this next step is, continued expansion into what we're doing and what we're talking about. Um, we've got some great episodes already planned coming up here for our first several months that we're really excited about. Some archival stuff, some net new. But we hope that it's, stories that really resonate with you and stories that are insightful and helpful in your own healthcare journey.
Absolutely, absolutely, Julie. And I'm incredibly excited about this. I think, you know, we we always want to stay, cutting edge, and we have tried to be that very much, for our generation, and even for our members of Gen Z who also engage with us and are wonderful. And this is that next phase, and maintaining that, as I was mentioning before, everybody has so much on their plate, and having this podcast, this portability, we've had so many people express to us that they would love to be able to listen to us and to learn, and engage with us, but also be able to do it sometimes while they're multitasking, which we all have to
Yeah.
do. And so that's also, a part of this, is making this very, very, portable, and easy to engage with. The other thing I think is that this gives us, the opportunity to really expand the number of topics we can cover. And we cover a lot of topics already. I mean, if
Yeah.
you look at the site, we have covered mental health, fitness, heart health, and we're going to continue to do all of that. Um, you know, cancer, POTS, I know I'm missing a few. I mean, so many different topics, but this actually gives us a chance to expand even more on that. And there are a lot of people as well who like, being on audio, being recorded. So some people that we've had the opportunity to do articles with, but we've never had the opportunity to do any kind of live video or live recording with. Some of our contributors and new ones as well are going to be joining us. And so I think that's really an exciting part of this. And we're going to also be bringing in, no surprise there, my favorite, some research. I know we have research in almost all of our articles, evidence-based research, but this is going to give us a chance, for example, to have, a monthly spot that is going to be dedicated to research. So for all of you out there who, either are research buffs, or professionally or just personally enjoy hearing about cutting edge research from a credible source, you don't necessarily always look for it. We will make it easy for you to find it, because we will be doing an episode dedicated to that with different topics. So I think there's just so much opportunity for us to expand, and also for more people to learn about us, because as Julie was saying, like, there is just a huge gap if you look, in a lot of different areas in healthcare, whether it's colorectal cancer or it's preventative care, in other areas, really, there's just not, that availability for resources for people of our age. There's such, as I've said from the first day, that why my health came into being, is like there is a misconception that everybody in their 20s, 30s, and even early 40s is young and invincible and healthy. And a lot of people are healthy, but none of us are invincible. And I think, unfortunately, and so this really gives us that power, that Why My Health gives us, to have those tools and that information we need so that we can stay, as healthy as we can be, and really live, as we always say, our best life, is just so important.
Yeah. I think the other thing we talk about is the fact that our healthcare system has been changing and is continuing to change, and how that has made, in many ways, it more difficult to, um, find and access care. And I think that that's another piece of this as well, is that
Yeah.
uh, knowledge is power. And I think when what we talk about all the time is there's so much self-advocacy that has to happen with your own healthcare, um, that's important. That it's important to know, and empower yourself with these topics, especially if it's something that you find could potentially relate to you. Um, and
Yes.
I think also, from a practitioner standpoint, hearing from them how things are changing, what things look like, what you need to know, um, is, that kind of like secondary action piece of, okay, you guys are telling us about all of these topics, but like, what do I do with that information? Like, what does this mean for me? Or for those who, I know and love who
Yeah.
might be affected by one of these conditions. Um, and so I hope that this podcast is something that, informs everyone, but also is, yeah, something that gives you a takeaway too, that you finish an episode and you have potentially a next step in your healthcare journey. Um, but if not, then it's something that at least you've learned something new, and maybe it's something that you share with someone else.
No, absolutely. That is what we want. We always are all about takeaways and giving you those steps, those actions that you can take, because that is something that you really can't find in many places, and you can't find it like at all for our age group. And so we're definitely here to provide that to you as part of this podcast, and as we have in previous content, but now in a new and expanded way,
Yeah.
really including a lot of new contributors as well. And I was going to say, a note as far as the contributors, we've had contributors from 24 states in the US, which is awesome, and we're hoping to reach all states. But one of the things that's really important to your point, Julie, is that, like, we always do want to know what topics are of interest to you, and that is how we have gotten to where we are today. Because the only way, and we learned this early on, the only way to really keep your finger on the pulse, as they say, of what's important in millennial health is to talk to lots of people. And we talk to people in different parts of the country, all three age ranges within the millennial spectrums, people in their 20s, 30s, and 40s. And by doing that, we're able to find out what is most important to everybody, seeing where those patterns are. There are so many things that's very interesting, regardless of what part of the country you're in, regardless of what industry you're in professionally. There are several key elements in common that we all have, and concerns and areas of interest in health, which is very interesting, but also really helps us to continue to provide um, what you're looking for, and what will be helpful to you in your healthcare journey. And so we definitely want to hear from you. That has definitely been something that's been the base of us really throughout. So
Yeah, absolutely.
absolutely,
And I think,
absolutely.
what we've talked a little bit about what people can expect from topics and who
Yeah.
will be, having as guests on the podcast itself. I think the other thing that I would just let people know is that the plan is to drop episodes twice a week. One will be in longer, in-depth style episode. Again, the topics will change week to week, but being able to have the time to go nitty-gritty into whatever the topic is for that week. And we plan on having those go out on Thursdays. And on Mondays, we will have our mini-sodes. So shorter
Yep.
episodes that have just quick hits of information. Again, those will also change week to week, but if you only have maybe, let's say, like 20-ish minutes to listen to something, maybe a
Yep.
mini-sode is the perfect size for you. But also know that many podcast listeners enjoy to have something long form where they really get to dig deep, and that's what those Thursdays episodes will be for. You'll also be able to access episodes on YouTube. So if you prefer to watch something versus
Yep.
just listening to it, you have that option as well. And we'll also be taking interviews and doing recaps and transcripts on the website. So really, whatever format that you prefer, you can access, and you'll be able to stay up to date with us or give us your suggestions for those topics or tell your story with us on social media, or if you want to reach out to us via the website, you can do that also.
Absolutely. And the other miniature kind of episode that will be dropping every now and then will be our Wellness Wednesdays. We've got some great people lined up, massage therapists, physical therapists, yoga instructors who are going to talk with us because we all know that wellness is extremely important to our generation and uh, maintaining balance in life as best we can. So we'll definitely be looking forward to those as well.
Yeah, absolutely. A
Mhm.
well-rounded, I think, approach to health is what we're looking for. Physical health, mental health, wellness, um, all aspects is really what we'll be coming at it with.
Absolutely. 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 And I think that people will really um, find some of the topics that will really teach you something new that and hopefully more than one thing that is new. That's always my goal and in all of our episodes to at least take one thing away that you didn't learn before. And so I think whether you're looking for preventive care information, you're currently going through um, you know a particular health challenge, we will be able to offer you a lot of different perspectives from people who are your age and really be able to give you actual advice that you can use, which I think that is something that is very, very hard to find. And we also try to bring you things from our contributors that are kind of, as we say, like insider knowledge on different topics, and that's always really, really helpful too, I think,
Yeah,
for people to have. So that is what we will be bringing to you, and it's just such an exciting time for us because to really grow from only having 3 contributors initially to having over 100 now in 24 states is just awesome, and to see the level of engagement from all of you, it has really been so rewarding for us because we value your opinions, and we know how important health is, and everyone's health, it's the most important thing in your life. But to be able to hear from people in our generation knowing that we're providing such a valuable service is just awesome. So we're excited to be able to reach many new fellow millennials, and we also of course welcome everyone of all ages, even though we are you know for millennials by millennials. We've been very fortunate to have uh, people from Gen X and Gen Z engage with us as well, because we do things in such a unique way, I think, that really engages people of all ages with their health. But again, we're just really excited to launch this podcast and uh, bring you some really unique things to listen to, teach some new things, and really connect you with other people. That's another big thing. Connect you with other
yeah,
people that you may have never met before. And Julie and I certainly, through Why My Health, have connected with more people um, than ever before that we did not know. And it's that shared common motivation for health and wanting to help people that has brought all of us together around the country. So we're excited to showcase some of these incredible contributors to you, to give you their contact info so that you can connect with them if that's something of interest to you as well. Because finding these people, it's like diamonds, and the rough, as they say, is not always the easiest. And there's some really incredible millennials out there doing amazing things for individuals' health. And so I'm very excited to be able to share that with you as well.
yeah.
Yeah.
So thank you so much for joining us. I hope this has been helpful in giving people the history of how we came to be, what we're planning to do, and um, maybe build some excitement for some of our first episodes. Um, and yeah, like like Melissa said, we're just so grateful to have this community and to be able
Yeah.
to continue to nurture and grow it. So we hope that you all appreciate the podcast as well.
Yeah. Thank you, Julie. Yes, we are very grateful for our community, and we really hope you enjoy the podcast. And we look forward to hearing from you.
Yeah, absolutely. Alrighty. Thanks, everyone.
All right.
Talk soon.
Thank you.